Hey guys, I want to talk to you about chronic degenerative knee issues. Now, we see a lot of people that have knee problems that come in here. Everybody from 16 years old all the way up to 90 years old and everything in between. So, I want to specifically talk to you today about chronic degenerative knee problems. Knee problems that you don't really know how it happened, it just kind of happened. In other words, you have no known injury that may have caused your knees to degenerate the way they did. So I want to talk to you about that. So when you're analyzing biomechanics of somebody, you're going to notice that when they have knee problems, and in most cases it's on both sides of the body, we're going to see hip issues, we're going to see knee issues, all the way down to the feet, not to mention your low back. And that's exactly where we're going to go to look at these issues at, because the nerves that come out of your low back go down both legs. So if we're having issues on both sides of the body, which is extremely common, we need to go to the back and see what's going on there. So there's a group of nerves that come out of L2, L3, and L4 right here. And they're called the lateral femoral cutaneous nerves and the obturator and femoral nerves. Now these nerves innervate your quadriceps and your adductor muscles on the insides of your legs. They control biomechanics on the front side of your legs. Now we also have a group of nerves that come out of L4, L5, S1, and S2 out of your low back that come together to form the sciatic nerve. And the sciatic nerve innervates the hamstring muscles behind the back of your leg. Not to mention your hamstring muscles, but also your popliteus muscle, which is extremely important. They call it the key to the knee. It solely unlocks your knee. That's what that muscle does. Now, if we have a problem with the nerves, then we're obviously going to have a problem with the muscles that control the joints. Your joints are just kind of caught in the middle of everything, unfortunately. So if we have muscles that aren't working correctly, over a period of time, you're going to degenerate your knees. So you go from having a knee that looks like this to a knee that looks like this. So we're seeing major degeneration in that knee for no known cause. There's no injury or anything like that. So when we go to the back, we want to look at a few things. We want to see a back that looks just like this. You see the disc, how fluffy it is. On the side, we see how the nerve is coming out of the intervertebral foramen. The hole looks nice and pretty right there. That is exactly what a normal looking lumbar spine should look like. However, if you suffer from knee problems, or back problems for that matter, your back may look like this. Now when that actually happens, you're going to end up having these nerves here are going to be compromised, okay? And they're going to be compressed in your low back. So those specific nerves, if those nerves go to the muscles that control your knee, you're going to wear your knee out over a period of a couple years all the way up to maybe a couple decades, depending on your type of situation. So hope that clears up a little bit for you as far as why you may have chronic degenerative knee issues and you don't know how it happened or why you may be dealing with them. So if you like this video, share it to somebody that may get something useful out of this information, and I will see you on the next video.